I'm Sherry Miller Jolly, and I am with who I'm always with, Leslie Pasco, the lifestyle dentist. And today we are talking to Alyssa Edge with Sail Away Media and Patty DeGangi with Beyond Oral Health. And you can go to her website, beyondoralhealth.com, to check out some of the books she's read. And during this time in the United States history, we are all home from work because of the coronavirus. And that has brought up a lot of very interesting topics about how this affects dentistry and everyone's livelihood that is connected to dentistry. And it's also brought up the topic of teledentistry. So often we've heard the term and most of us don't know what it means or how we can even do it. But if there's a way to see a patient without opening up your office, there actually are ways. It's called teledentistry, and there's actually ADA codes for it. Patty has written a book called Tele-dentistry, The Pathway to Prosperity. And I have the book because I wanted to learn how to code teledentistry visits. And so I'm going to start with Patty. Patty, just tell me exactly what teledentistry is.
Tele-dentistry is nothing more than the connection to someone through a different way than them actually coming to our dental offices. Our tradition is that we've thought that the only place dentistry can happen is in a brick and mortar office. That's not the case. And the reality is we can go meet people where they are from using remote technologies, by using technology. We're all seeing it now, whether we're watching the news or whatever, that people are remotely connecting onto the TV station or into the media, and that's a form of electronic communication. That's all it is. It's a form of communication. It's not really a thing in and of itself.
Okay. And mostly teledentistry is like in this type of environment today, in today's environment where a lot of dental offices are actually just closed. I would think that most commonly we'd be using it for emergencies because there are people who are getting toothaches whether we're open or not, and right now they'll be going to the emergency rooms. And the emergency room is full already of other sick people, and they probably won't get treated. And they might get given an antibiotic or sent away, but tell me if I'm wrong, but usually there's no one in the emergency room who can even
that circumstance is no matter what time, whether we're under this crisis or not. But because we're under the crisis now, depending on where you are in the country now, I happen to be in a state that has a lot of problems with the numbers of people that are in our emergency rooms. They probably can't even get into an emergency room because they're doing triage out on the sidewalk. And a toothache is not going to meet even the qualification, or bleeding gums or whatever all they might be going. Their face is swollen. They're not going to actually be able to even get in at all. On a regular basis, what you said is absolutely true. In emergency rooms, that there is not usually there's somewhere that there's a dentist on staff, but they're not there. They're never there when the person needs them. So most often, yes, they walk away with an antibiotic and a painkiller, and that's the only thing they get. Teledentistry, we can talk about the long term, and then we'll go back to the short term. In the long term, think about an ER doc or nurse that could have a teledentistry camera that hooks up to the dentist remotely. What a difference we could make that way. So that's the longer term picture I've been talking about for a while. But on the shorter term, it really is significant now because, again, oral health problems are not going to be considered. Just as we have already been considered that our treatment is non-essential. That's why we're all home. I think that that's going to be a real problem that we're going to have in the future to help unteach the public that what we do and the treatment that we offer is actually very essential. Under this crisis, it might be considered non-essential, but that's not really the case because we've all heard the mouth and the body are connected, right? Yeah, of course we have. Yet the reality of it is it's not recognized on a regular basis, and now we're in a crisis that's going to be recognized less. So that's where the power of teledentistry comes in. And even the American Dental Association is encouraging dentists to see new patients through teledentistry because they need help. and somebody, and we're the professionals that can help them.
Yeah, Patty, I have to say, if I could chime in for a second, I really agree with you, and it's been something that's been on my mind. Dentists need to be part of the medical community, and we've been extracted, no pun intended, but we've been extracted from that. And us not being allowed to help our patients, I'm in the state of Pennsylvania. They actually were the only state that's not allowed to treat emergency dental patients. So I can't even see someone if they have a toothache, if they're swollen. I can't go into the office. To me, those are life-threatening situations. In part of my teledentistry protocol, I know that Alyssa will get into this later, is asking certain questions because some dental issues are life-threatening. I think we all know that. We've all heard the stories. So, and I also want to comment on that I feel that the way dentists have been portrayed, and also how it was termed essential by the American Dental Association, has sent dentistry backwards 50 years, where people just went to the dentist when they're in pain. And actually, I wanted to play, I think I can screen share this, if it's okay with you guys. I think I can do a screen share here. Let me see, share. I'm gonna share the screen. And I just wanna show you guys, Josh, a dentist, Joshua Austin, posted this. Can you guys see my screen?
Yep. Mm-hmm.
Good. He posted this. Let me move this out of the way.
Doctor. Also getting supplies for your family at the grocery store.
Okay, so this was on TV on a news channel. See if you guys can hear this.
Stay home, work safe ordinance. You must stay home unless you're out there for a few reasons. One, health-related reasons like a medical appointment, a medical doctor's appointment, not dentist, but a doctor.
Okay, so do you hear that? Not a dentist, but a doctor. So basically, we're not considered, what they're saying there is that we're not considered to be doctors. So that really bothers me from that aspect. I'm trying to get this so that we can
stop sharing. Yeah,
stop sharing the screen here. I'm not really, oh, here it is. What that's saying is that basically we're not doctors. It's, if you have an emergency, you know, you can go see a medical doctor, a doctor, not a dentist, a doctor. Those words, I mean, that's like a stab in the heart for me, because I know that when I see patients and I fix their teeth, I'm adding years to their life. I'm helping them be healthier, because we know the mouth is part of the overall body health. I just wanted to share that.
You know, if I can too, that's wrong on so many levels, even from the Centers for Medicare and Medicaid. CMS, first of all, that's the biggest insuring body in this country. And CMS in 2013 redefined in a federal register what is the definition of a physician. And a physician definition includes a doctor of dental surgery and a doctor of oral medicine. So even from an accuracy, that's inaccurate what that reporter was saying. Dentistry, not a real doctor. Yeah, that's unfortunately the way the perception of oral health has been, but it's wrong on every level, even from a definitional level from our federal government.
Well, so that's very interesting. So I'm sitting here flipping the pages for Patty's book, and there's a chapter 5, basically what procedures can be done in teledentistry. And we're already talking, since we're, you know, the times today are about seeing patients remotely, and there's 2 ways to see them. There's synchronous and asynchronous. So synchronous, Patty, that's like using an app like we're using right now, the Zoom with a video chat. Is that correct?
Did you want to see my mouth? That's a synchronous.
Okay.
So go to diagnosis doc.
So that's if you're talking to your patient face to face, but using an electronic video type of medium.
Exactly.
And that's what some people would say in real time.
Right.
And the examples of codes that would be billed with this would be mostly your exam codes. I really like the fact that you put on here the caries risk assessment codes in here, because there's so many times when I think that if we had just billed a caries risk assessment code, we wouldn't be questioned when we sent in that big treatment plan for the other stuff, but people aren't using it because they're not reimbursed. But a Carrie's risk assessment also would work for, I'm thinking about all those Head Start kids. It's so hard to get them their exams done every year, and where do you take them? I've worked in enough Medicaid clinics to know when it's Head Start season, and all the 4-year-olds that we have to do exams on. So that's definitely something that I was thinking. But tell me, because this is something that I wouldn't automatically connect. What does asynchronous mean?
Asynchronous means it's a store and forward. I'll give you the example of how store and forward can work. My co-author of the book, Cindy Purdy, lives 2 hours west of Colorado Springs, Colorado. Now, because she's in Colorado, she means she is an independent hygienist, because you don't have to work in independent practice. She's an independent hygienist. That's what it's considered in that state. So she has a lot more leeway than any hygienist is going to have in Pennsylvania or what I have here in Illinois. So with that as a starting place, in her community, the only dentist in town passed away. She is the only oral health professional in 60 miles radius. So she made an agreement with a dentist that's 60 miles away. She will see his patients and do some triage or whatever. And when they started, they tried to do it as a synchronous connection, but because of where they are in the mountains, it didn't connect right. So what she does instead is she does all of the evaluation aspects and all the parts that they've agreed on are the important part of the exam steps. Then she saves it, she stores it, and she sends it to him. He will read it, see it, make the diagnosis, and then send her back the order for the treatment she should perform. Now, we can do that synchronously in some states, and we can do it asynchronously in some states, because this is where teledentistry can get a little complex for some people to think about. It's not just the codes and the procedures that we can perform. It's who can perform them can be limited by state practice acts, licensure, a variety of HIPAA regulations, and there's a lot to understand about whether or not certain things can be done in certain places. Like I said, in Cindy's place, but asynchronous means basically you're storing it. It's like I record a video and I'm going to send it to you via email, so to speak.
So if I was a mom who was stuck home with my children who are canceled school and they were not being good kids and somebody fell, I could take pictures and send it to the doctor, and that would be considered an asynchronous evaluation?
Well, it depends on what the doctor does with it. And also, we have to be a little bit careful about how we talk about what systems we can do for transferring of it. Still comes under PHI, personal health information, and there's some limitations that even though HIPAA rules have been relaxed from a federal level, states might have their own HIPAA rules. From a compliance point of view, can the mom send it to us? Sure. How we send it back, or how we as professionals have a duty to follow HIPAA guidelines, can be different. So it's like yes and no. So I don't think we call that necessarily somebody sending you pictures asynchronous. It's more a professional that would take the information, send it to another professional, so to speak.
Okay. All right. Well, the HIPAA question actually has come up before, because we all have run into that with email. If you've been in a dental office in the last 10 years and you've had to use HIPAA compliant email and you can't figure out how to unencrypt that x-ray or send it encrypted, or get the call from the other office says you sent me x-rays but I can't open them. That's one of those, your girls at the front, one of those phone calls they take regularly. But so this is also how we can encrypt. We can do lots of things. We have two-party verification when we log in remotely to a web-based software. But what I find really quite innovative, Alyssa and Dr. Pascoe have developed a virtual dental consult for Dr. Pascoe's patients during this time, where she can actually consult with her patients in a HIPAA compliant platform that is basically web-based. And Alyssa can develop these for any dentist who might need this platform at this time, especially since none of us know when we're going back to work. Alyssa, tell us a little bit about that.
For sure. So I worked with Dr. Pasco since the end of last week. We were kind of trying to rush to get this up and running because she had patients that were interested in being seen virtually. So what we developed isn't necessarily a way for her to kind of hop on and speak with them. For that, she is using Zoom, which is, a very commonly used platform. We're on it right now. But rather, it's a way for patients to find out that A, she offers this as a service, and B, to be able to fill it out, provide information that she needs, like take a picture of their mouth, provide their email address, their phone number, and schedule a time directly on her calendar. So that everything gets set up, and then it automatically sends them a Zoom link. So everything is all integrated. And I'm gonna go ahead and share my screen and give you guys a little bit of a demo. Before I do that, do you have any questions?
I just want to point out for anybody who doesn't have a Zoom account, there is a HIPAA compliant Zoom account and a non-HIPAA compliant Zoom account. So if you're going to do something like this, make sure you pay for the HIPAA compliant version, which means you cannot upload your meetings to the cloud. That's
the
basically.
other thing, because so many people have been wanting to do this right now, is we did a little bit of research around other available platforms that are HIPAA compliant. GoToMeeting is a great alternative. They have a HIPAA compliant version, and I think it's only $19 a month, while the Zoom HIPAA compliant is $200. So it's definitely, it doesn't have as many capabilities as Zoom, but if you're looking for something a little bit more basic, something to look into.
Okay, so show us what you have.
Okay. You guys can see my screen?
Yes.
Awesome. Okay, so this is basically just an introduction page that talks a little bit about Dr. Pasco's qualifications. We put a little banner up here talking about, regarding COVID-19. This is a really great way for A, you to decrease risk of infection, and B, skip the emergency room and be in the comfort of your own home. So kind of just putting that out there. And then we talk a little bit about how it works. So the first step would be them submitting a selfie as an image on the form on the next page, and then they have the option to schedule a time directly with Dr. Pasco. And then the third step is that they will receive an email with a Zoom link for them to be able to log on and connect with her. Down here, it talks a little bit more about, the benefits of a virtual appointment. This is great right now while all the offices are closed and people are sitting at home, but it's going to be great in the future too, because you get to skip the sitting in the waiting room if you're not sure that you really need to go into the dentist. You don't have to drive anywhere. It's really just the way of the future is,
I can think of so many ways. I can think of so many things that this is.
I can think about it just from the fact that I had an appointment with a healthcare provider and they said, you need to come up and do some papers. I said, no, I'm going to sit in my car till you tell me I'm coming in the room.
Yeah.
So, yeah.
Yep. So the next step is they click Let's Get Started, and then this is where we integrated the form. So just a really simple way for them to provide information. So they put their name, their email, their phone number, what they would like to have evaluated at their virtual appointment. And props to Dr. Pasco. She really helped guide what questions we needed, what kind of information we needed answered. And then we have the option here to take a photo. So I come right up and I can go, and then we also have the option to upload any additional images or scans. So, if you have something on your computer, maybe you have a scan from a previous appointment, you can upload that here and she'll receive it. In this specific case, we decided it was going to cost $35 for this virtual appointment, but we did create a coupon code, which was pretty cool. So if they are an existing patient, they can get it for free by entering the coupon code we can provide them.
And I see here on your site, you've given the patient the option to get reimbursed by submitting it themselves with this code.
Yes.
Which is, that's nice. But if you were a dental office and you were to be submitting this code for the patient, you would be using code so this would be a live chat, right? In the end, they click the link and it's a live chat.
After this is over?
Yes.
Yes, it's gonna be a live chat.
Okay, so then they would use code. You might have to help me, Patty, because I haven't found the
Right,
code.
well, I'm trying to understand how that this is a 0140, the virtual appointment.
Yeah, Sherry, this was a code you gave me several days ago. When
Yeah,
we,
that's for problem-focused evaluation.
yeah,
But
because
no evaluation has been performed. This is making the appointment for the performance of it, and so they're paying in advance.
the patient pays the $35 and they can submit it to their insurance. So that part we're still working out. So we're just seeing how it goes. No one's really said anything. I've had several of these. No one's actually really cared about submitting it to their insurance.
Right,
But
because how would the paperwork be done from here?
we're gonna
Get to the next step, because we didn't finish yet. So they would finish all of this, they would put their credit card, and then there's an automatic redirect that goes right here. So it will say, congratulations, you've requested a consultation. Now you can click here to begin the paperwork so you can get registered as a new patient, or you can click download the dental claim form, and then this is where they would file a claim, I guess. I don't know, I'm no expert on this stuff. I was
gonna say, how is that part?
website.
Yeah, okay, that's a claim form, but a patient can't fill that out themselves.
Oh, they can?
No.
Yeah, no, that's,
No,
so if they were to submit a claim themselves, they would, their insurance company is going to give them a form to fill out. That's not this form.
Oh, well then that's fine. We just put that up there today. So Alyssa, you can take it down.
I'll take that.
But the point is that if you were to do, so they've gone through this nifty little website, they've made a virtual appointment, and when they do the virtual exam, it's going to be a live chat with the doctor.
Exactly.
So
so now they go here and they can choose a time. So they can say, you know what, I'm looking for Friday, 11 a.m. and this is integrated with Dr. Pasco's calendar. I can sign up right here, and then it's going to automatically add something to my Google Calendar as well as her Google Calendar, and we'll both have the link to log in. So really this whole thing is just a shortcut for people to get scheduled.
Yeah, so
Right.
this is
okay. So with the going back to the claim form part, is the date of service then the date of the appointment? What's the date of service that's going to go with the 0140 code?
it would, well, it would have to be the date that of the appointment.
It has to be the date of the appointment, the date of the treatment. It can't be the date that they
Make the appointment. Yeah.
Yeah, just to chime in, Alyssa and I just put the form on. We actually went back and forth. Should we put it on or should we not? I thought just as a helpful thing. I mean, like I said, most people don't care about submitting it to their insurance. If this continues to go and grow like the way I think it is, then we'll definitely figure those bugs out. But I've had people, new people, pay readily the $35, and you know, it really helps them. It's 15 minutes, and they're very appreciative, very helpform.
And we just
$35 fee is a very generous, low cost for that service. It's just the order that form is offered, I think, is the only thing that would be a challenge. But it's a very generous, and the idea that will help them facilitate if they have coverage. And that's where the American Dental Association is helping everybody, because ADA has created, and I don't know, I'm going to hold it up just like I held it in my book, but this is the American Dental Association COVID coding and billing interim guide that any office or any practice can pull up from the ADA. And what they're doing is they're talking about how you would bill out these teledentistry encounters. And because the $35 might be for the 0140, but are you going to charge a code under the Tele-dentistry synchronous code? There is a fee that you can charge for that. This goes into, that becomes more of a practice management discussion versus a coding. But what ADA has also included is some general information on what carriers might currently be accepting the 0140 code and the other codes that they list in here.
Yeah, that's good. Yeah, it's definitely a work in progress. And one of the things that I really appreciate about the way Alyssa went around doing this was, A, she set up real fast. B, it's something new that she's that she's never really set up before. She has set up consultations for dentists to connect to their website for just free smile evaluations, but that's not what I wanted. So she had to kind of restructure and redo things. And I think we're going to continue to work on developing this, because I also think that this is something that, you know, when mom's at home, infant sleeping, 2-year-old fell, hit their lip, or a 5-year-old fell, tooth came out, or another. I get so many patients that come in that say that there's something wrong with their kid's tooth, and it's really just their adult tooth coming in. So it's going to save trips to the dentist. Also, the software that I use, Oryx, this can connect with it. So I can be on my Oryx software because it's cloud-based while I'm talking to the patient. all the patient's paperwork connects right into that web page that you just saw, so they can enter in all their insurance information, and then most of the time we can bill the code for them. So once we get to that point, we'll probably take that insurance form and the code off,
Right.
Just because we'll just charge $35 for the evaluation, but then we can submit everything to their insurance as well.
I see.
So what you created in a beautiful way is an integrated solution, whereas other softwares that are out there, they're might be bridged to the practice management software, but yours is an integrated to your software tool, so you're not just taking a copy of, here's a PDF of what was done and now it's in their charts somewhere. It's actually integrated into the software system. That's awesome. That's really terrific.
I think what's really cool is that we just got this finished yesterday, and Leslie has already had 3 people fill it out. So there's obviously a demand for this, you know, people are really interested.
I think I'm thinking about all of my mind is racing with all of the ways that it could work. It can work for kids, it can work for seniors who can't get out, it can work for nursing homes where the patients, I mean, if you've ever been in public health at all, you know that there are times when the patients can't leave their facility, but they have a dental emergency and the team has to go to them. Very hard to get done. And there's all of these things. So if there's anything that I get out of this, it's a little bit of like positivity in this cloud that's hanging over us, that there's some real answers, because if you've been online, you've been talking to a dentist or anything like that, it's what's going to happen to us. Where's this going to go? And here is the first step. This is what we can do now. And this is going to change our practice when we go back to work. It's going to change our consults. It's going to change, you know, our hygiene days. It has so many applications. It'll be amazing how many ways we can use this.
And this is where, in my experience and in my life, the dark times are sometimes can be the best times, because we can learn and we can grow, and all those things we never have time to get to. We have time. We have time. We have time to think through how we're going to integrate this. We have time to have virtual staff meetings with our team of how we're going to do things when we get back. And that's what the smart practitioners are doing, is let's not just wait for the future to happen and figure out how we're going to deal with it, but let's create our future. Let's build it out now toward the direction we want to go, because we know that this is, yes, it's a dark time now, but it will end. But we're never going to go back to where we were, in my opinion. We're never going to be like it was. This is, in my opinion, we've had, you know, like we had 9/11, everything about travel sure changed after 9/11, right? Well, we had 3/16 last Monday when the whole country basically shut down, and it's going to be different when we go back, and we can decide how we're going to make our own lives, work, and businesses different by proactive planning.
You know, Patty, you mentioned something, and this is something I've been thinking a lot about, and that's why it's great to have minds like all of ours come together. We've got the techie person, we've got the billing people, we've got someone who's been in dentistry in lots of different positions and different viewpoints for quite some time. My question is where do you see dentistry going in the future? I have my vision, but I'm curious, because you have so much experience in the dental arena, and you've talked to so many people on so many different levels. Where do you think dentistry is going to go in the future?
I think it's going to go, it needs to go. What people are going to be looking for on the other side of this, they're going to be looking for health. We have defined health in our country as the absence of disease. The absence of disease is not the same as health. And that's where, again, who are the people that are highest risk? Yeah, the part of it might be the age, but it's the comorbidities. And this whole idea of what we considered, if it ain't broke, don't fix it. An example of that even is how the testing protocol is for COVID at this point. You have to show symptoms to be tested. That's after the fact. You already got it. Well, dentistry's work that way too. We have it's like, if it ain't broke, don't fix it. Oh, you got a little hole, we'll wait till it's a big hole, because we got all kinds of fixes for that. That's where dentistry needs to move beyond, to really reach for total health, whether it's through Canberra, whether it's through, we have the, you know, the staging and grading for periodontal disease and things like that. Our steps toward that, but we have to revisualize it. We have to really look at what is the definition of oral health and how do we help our patients reach that. From a hygiene point of view, I'm always talking about how can we help them have a healthy biofilm. And for some people, that doesn't even make sense. But that really is our goal, because biofilm is going to be there anyway. How do we create one that supports health, to have a healthy microbiome, which is the whole body? How do we help create that? That's where dentistry can go, needs to go. It's not just about fixing holes.
Thank you for that. I couldn't agree more. I know that recently I've taken some time, and Sherry and I have talked about this, about where dentistry was 50 years ago. In fact, Sherry and I spent a day together on this, where dentistry was 50 years ago, where it is today, and where it's going in the future. And I think it's a bright future for dentistry. I think we have to, you said earlier, I think maybe before we recorded, maybe now, but that we're going to have to re-educate our patients, because our patients are now being taught once again that dentistry is elective. I mean, I know in Pennsylvania, dental offices cannot open unless they have an airtight, sealed, HIPAA filtrated treatment room, which nobody has. Now, my friend Dr. Joe Sillo, who runs AGH Oral Surgery Department, who's working really hard to change this, they got it done in the hospital, but it's in a hospital. You know, they made it happen. But a dentist in their office can't make that happen. But meanwhile, while I can't see emergencies, the beer distributor is open. I'm speechless.
And here's the thing about cost. I have allergies, and so I actually have eosinophilic asthma. Now, have you ever seen the commercial for Fasenra? Okay. I was getting my Fasenra injections in my allergist's office until I qualified for Medicare, and they go, oh, no, you can't do it here now. You got to go to the hospital. I just got in my bill for my co-payment that they charged me $13,000 for that injection in the hospital. And my copay is $897. That's nuts. Our healthcare system needs to change. My goal with my Beyond Oral Health is to unite people to change healthcare. Not just dentistry, but all of healthcare really needs a reset. We really need a big reset, because it's absolutely insane how much money we're spending on healthcare, but we're not very healthy as people.
Yeah.
As a nation.
That's true.
That is very true. Very true. That's incredible. That's an incredible.
Yeah, 13 grand.
Yeah, I hope that I'm always very optimistic that something good always comes out of something not so good. And I think that a lot of good will come out of this. I know that dentists right now are frustrated at the tying of our hands, so to speak. And I know that's going to mean a lot for Alyssa and her, Sail Away Media Company, because a lot of dentists are going to need her and her help in setting this up. And I know that it's probably going to mean a lot of extra work for Sherry, because she's going to have a lot of backlog that she has to pick up too. But I do believe that something really good is going to come out of this. We have to make it that way.
Absolutely.
You
know what? I already found the good, that we connected, and we can connect this way. This is a virtual. We don't know each other. We met 2 minutes before we started this, and this is the way. But it's the uniting of people on that same journey toward a positive outcome that'll get us through the short term, but it also will make us be better in the long term.
Absolutely. Well, awesome. Well, that's all I have. I don't know if anybody else has anything that they want to contribute.
Well, I do 3 to 5 hour courses, so as you can, doctor. But we probably have covered it pretty well at this point.
Well, thank you guys.
So we'll do a course together.
Yeah, really, that'd be a full day.
Oh, it'd be terrific. Yeah.
Yeah, well, maybe if anybody's watching this, once it's posted, that if anybody's interested in something like that, the 4 of us doing something together one day.
That'd be perfect.
Of course, that'd be great. Say something in the comments so that we know. And we'd be happy to put something together. We'll figure it out.
Connect to us through our websites too. We're happy to help.
Yeah. Okay. Well, I'm gonna thank you guys all for coming, and we'll see you again next time we're on Facebook.